Kind of the purpose of today's presentation is just to introduce what the SHARP survey is for those of you who are not as familiar. I'll go through kind of some state level findings and then how you can dive into more local level Summit County data. So with that, as I mentioned, we'll go through an overview of SHARP, some kind of state level data highlights. I'll go through a general like how to use a report, whether or not that's a state report or a county level report. I'm gonna briefly introduce this SHARP website and our data release for this administration. And then I do have some discussion and questions. So if we wanna do small group time, you can chat with the folks around you, and then of course I'll be here to answer questions as well. Okay. So introducing the SHARP survey, I'm going to start with a question. How did Utah lower underage drinking by 70% in less than 20 years? And a big reason for this is that we listen to teens, and obviously that's going to transition into use of SHARP data in this survey. But campaigns like Parents Empowered rely on SHARP data in order to target prevention that actually works in the state of Utah. So Parents Empowered is an education campaign many of you are probably familiar with in Utah that's designed to prevent and reduce underage drinking. It began in 2006, and since then we've seen that the rates of underage drinking have dropped by a staggering 70%. And so Parents Empowered campaign is able to cite this statistic because of the SHARP survey and the data we collect regarding teen substance use. It's one of the most valuable data collection tools in the state of Utah because it provides parents, schools, public health professionals, coalitions with information that we can't get anywhere else or from any other source because the information is actually coming from the students themselves. You'll notice, and I'll get into this at the end of the presentation, that we're really intentional about the way that we are advertising the SHARP survey to the state and data users. So we've kind of identified our core tenets of what we believe is important for the SHARP, starting with that it is confidential. This is a question that I get pretty often, like how do you know that the data can't be tracked to a specific student? Schools are given unique URLs. We don't ask any identifying information. There's no student ID that's used. We can't track it to a specific device. It's given in a controlled environment. So that's the biggest thing that we tend to drive home is that SHARP is confidential. We're not getting any information about a specific student. I'll also go into some data cleaning things that we do to ensure that this data is confidential to whoever's taking it. It's also voluntary. So we have several layers of consent in the state of Utah. We ask schools whether or not they're interested in offering it to students. We have parents opt students into the survey. Students are then asked whether or not they consent to take the survey, and then they can opt out at any time while they're actually taking it, and there's no penalty to stopping taking the survey. We do take any response, so if students skip questions, their participation is not nullified at that point, and we're just getting as much data from students as they're willing to give us. SHARP is not harmful. This is probably our second most frequently asked question, is if you ask about substance use, if you ask about suicide, is that gonna cause my student to become suicidal or to be curious about drugs? Not only are we not seeing that in any of the Utah data, but there is a plethora of research that just goes to show that asking about risk-taking behaviors does not cause them to happen even in adolescence. If anyone ever is curious about the actual research behind that, I always offer that I have that and able to share with folks. SHARP is easy to access. We not only make sure that folks can register easily, but we also make sure that we really kind of handhold districts in making sure that they can administer the survey in a way that's really efficient. We get all of the survey coordinators set up with everything they need to make sure that SHARP is accessible, that it's easy to use in a district, they have everything they need. And we try to do that throughout the administration. So before administering the survey, we check in to make sure that survey coordinators feel well equipped. We offer support during the survey. If you're approaching the end of a survey and we haven't heard anything or seen any movement, we'll follow up again and make sure that folks are kind of well equipped so that this survey is easy to access in their district. We're transparent. Hopefully this slide is an example of that. We are very open. I'm always open to questions that I get from anyone that's concerned about any aspects of the SHARP. And you'll see this again at the end of the presentation, we've done a lot of work to make sure that all of the surveys are publicly available, state reports are available to the public and to parents. We are really communicative about how the data is being used and sharing coalitions that use our data. My email is hopefully plastered everywhere so that people can come to me with questions about the survey. So we try to be as transparent as possible because we realize when we're in schools and we're asking teenagers questions, that can be pretty touchy. So we try to be as transparent as possible. The last two, SHARP is valid. We do get questions, although not as frequent, like how much can we trust this data? We have a number of like honesty question checks that we have in place. We go through really rigorous data cleaning. We have a new relative standard error measure that we include and new data suppression rules. So we're really confident that everything I'll be discussing today is actually what we're seeing in the state of Utah. And then finally, SHARP is free. This kind of goes hand in hand with easy to access. We want to provide a free survey to every district in the state of Utah to make sure that everyone has access to this type of data in their own communities. And part of that is making it free and easy to access. I'm gonna take a drink of water, one second. In terms of survey participants, we survey all the way from 6th through 12th grade. So this includes kind of even number years, so 6th grade, 8th grade, 10th grade, and 12th grade. 6th graders notably do not get the same survey as 8th through 12th graders. So you'll notice as I go through some of the data, 6th graders are missing in a few places, and it's just because we give them a more developmentally appropriate shortened version of the survey. That being said, topics for every grade include physical, social, and mental health. So we are monitoring health behaviors, any substance use. This includes priority substances like alcohol, marijuana, and tobacco, although we do ask about other substances as well. Social connections, this includes both with peer, individual, and community, teachers, parents. Basic demographic questions, we did make our sexual orientation and gender identity questions, what is the word I'm looking for? Voluntary, like you could opt in or opt out of including those questions on the survey. Optional is the word I was looking for. So you'll notice that some demographic data is missing, and what I'll be talking about as well. And then risky and harmful behaviors, so any like risk-taking behaviors. We also measure what protects kids from these types of behaviors. So this is often what I will redirect folks to when they ask about not only like, is this survey harmful, but I'll also sprinkle in like, we also ask about protective factors and things that bolster connection with parents and peers and kind of what's protecting kids who may be at risk for certain types of behaviors. So risk factors are again anything that put kids at risk. This can include things like media, any like antisocial behavior, connections with antisocial peers. But we also collect protective factor data. These are things that protect kids from risk. So things like social bonding. I have a slide later that talks about the importance of family meals and engaging with parents and guardians at the end of the day. So we do have some really rich data of kind of how you can use everything that I'll be discussing within your local communities. And then finally, who's using SHARP data? As I mentioned, we try to be as transparent as possible, so our state reports are publicly available. We hear success stories from parents and families who use the data, schools, districts, and school boards, local health departments, community prevention coalitions. We have great local substance use and mental health program representatives that come to these types of trainings, city and county level government. We do often speak with the Utah State Board of Education, the legislature, and then obviously partner with the Department of Health and Human Services to administer the survey. And so SHARP helps us understand what teens think, feel, and experience. Again, we're providing families, parents, schools, community leaders with information that they can't get anywhere else because we're asking the students themselves what they're experiencing. And so I wanted to call out just a couple of programs that you're probably familiar with at the state level that use SHARP data. This includes the Safe Utah app, which connects kids with crisis counselors, See Through the Vape, resources for talking to your child about the dangers of vaping. We have Parents Empowered, resources to talk to your kids about the dangers of underage drinking. Live On is a suicide prevention program, and then Social Harms to help kids learn about the dangers of social media. So all of these programs have reference SHARP data and obviously make a great difference in prevention at the state level. And so with that, I'm gonna get into some actual state level findings. So I'll first start with kind of a unique 2025 overview. So we piloted, as I mentioned, our new 6th grade survey this year. This is something we've been working on for a while. It's shorter, it's more readable, it's more developmentally appropriate for 6th graders. I encourage you to ask questions. I've gotten at least 1 or 2 every presentation I've done about like, why didn't a 6th grader get this survey question? We have a pretty robust team of folks who evaluate questions that are not included on the survey, including developmental experts, statisticians who are doing cognitive testing, but please feel free to kind of push back and ask questions if you have them. This administration, we surveyed 39 districts, 16 charter schools and 1 private school. You probably know we only have 41 districts in the state of Utah, so this is great representation at the state level. We only had 2 districts opt out. We also had House Bill 182 in this administration. For those of you who aren't familiar, this just requires that we gather consent for the SHARP survey during fall registration. This included some interesting challenges because that is not usually how we gather consent. We don't usually do it during fall registration, but since we did so, we actually found out that that is a great way to gather consent. So it brought kind of some interesting challenges at first, but overall, we've got really robust participation in this administration. We do have a continued increase in both school board level involvement and decision making. So we're always connecting with folks at the local level, whether or not that's parents or people that are on the school board or parents who are on the school board who have a lot of questions about the SHARP. So we do see continued involvement from folks at the local level. Nearly 100% of participation was collected online this administration. So we do offer paper surveys as part of our accessibility campaign, but we do see, which makes a lot of sense, right? Most folks are using the internet. YRBS component was most likely not successful. Part of that had to do with our change in the consent gathering process. We're really hopeful that next administration will see participation be a lot more robust. Yeah.
Will you explain what YRBS is?
Oh, yes. So for those of you who are unfamiliar, YRBS is data that is provided to the CDC to create a national sample for the state of Utah. So every state has a YRBS. It's the Youth Risk and Behavior Survey, I believe is what it stands for. You can find it through the CDC website. Every state provides data, but there is a minimum requirement to have a robust enough sample to wait and provide for the CDC. So that's what we mean when we say most likely unsuccessful. We just didn't have very robust participation in this administration. Thank you for calling that out. And then I mentioned this earlier, we did make our SOGI questions optional this administration. We saw that most districts chose to exclude SOGI questions. And so with that, here is our participation in the last 22 years that we have administered the SHARP survey. So you'll see that data starts in 2003. We have about 10,000 participants. 20 years ago, the goal was simply just to get kind of region level data. Eventually, we've seen more of a district level model where folks are really excited to get participation that represents students in their own district. So that's where you start to see this climb over time. We saw in 2019 our high point at 86,346 surveys completed. Then came 2021 and 2023. Obviously COVID happened here, so we just saw a large decrease in participation. But as I mentioned, in 2025, we had a really strong rebound. Our total participation count for our 2025 administration was 78,705. Yes.
in terms of percentage of students, what does this graph look like?
Oh, like the actual breakout of grades, I'll cover that on the next slide.
So I'm just curious of like all the students in Utah, like, are we hitting 10%?
Oh, of the number of students that are enrolled in the state of Utah. That is a great question and not something I know off the top of my head. But it is we're confident that it's a representative sample of the state of Utah. Because we see, so there's different like levels of statistical reporting, but we're able to generate reports for every county that participates. So we're confident that it is representative of the state. Yeah, that's a great question though, and something that I can Google and share with you. In 2027 now, with like understanding House Bill 182 and how that impacts our consent gathering process, we are optimistic in our next administration that we actually surpass this 2019 number. So looking at the actual breakout of participation, you'll notice in reports we include statistics from the last 3 administrations. So we'll have 2021 data, 2023 data, and 2025 data. When you look at your participation counts, this is broken out by grade. We have gender, we do have that SOGI data here, and then basic race and ethnicity questions. As I mentioned, this year we collected over 78,000 surveys. The new 6th grade version really helped with engagement. We saw excellent response rates at 6th and 8th grades, and one of our best 10th grade years in quite a while. I want to call attention to the fact that 12th grade is a little bit lower. This is a harder group to reach. 12th graders are often have shorter days on campus. They might be doing something like an apprenticeship. You might see just lower engagement in general, the kind of feeling of like senioritis where 12th graders just opt out of taking the survey. That being said, our gender distribution is really well balanced this administration. Oops, wrong one. We see about a 50-50 split. We also see that our demographics look almost identical to the state enrollment for this age group, so we're confident that we're capturing accurate demographic data. I do want to call attention to the SOGI. Since we had so many opt-outs, this is likely not representative of the state.
I have a question.
Yeah.
On that slide, your percentages were just of your total participation within the SHARP. Do you know what, like of 12th graders, the 10,000 that participated, what percentage is that of 10th or 12th graders that could have participated? What's your participation rate, kind of, how many did you actually capture?
Right, of the students that are like able to take the
Yes.
survey, I don't know that off the top of my head. Yeah, I think our opt-out was really low though. It was like, I want to say it was almost like 2%. So of the students who were offered the survey, the opt-out rate was really low. Yeah. So our biggest takeaway, what we've taken from this year's data is that in general at the state level, Utah youth are making better choices and feeling better overall. And so I'll go through a couple of topics. This includes substance use, measures of school climate, mental health and suicide, etc. So with that, let's dive into our state data. So substance use, we see that fewer kids are using drugs and alcohol at the state level. We also see that fewer students are using drugs and alcohol across all grades at the state level. So let's pause for a moment and look at this slide. So on the left, you'll see this is the percentage of students reporting using a substance in the last 30 days. We call that 30-day use, so that's something that I'll refer to as we go through our data. It's our best indicator of more regular use of substances. So we'll have 30-day use and lifetime use. Lifetime use is often indicative of experimentation rather than regular use of a substance. So this is 30-day use. Again, the y-axis is showing the frequency. And then on this x-axis, you can see all the way from 2003, when we first started administering, to 2025, our latest administration. Each of these lines represents a substance, so we're gonna focus today on alcohol, marijuana, and vaping. So for alcohol, the turquoise line that you can see here, what you'll notice is that the Utah 30-day alcohol use in 2003 sat right around 12% for middle and high school age students, which you can see here. And then over the next 2 decades, it just keeps declining over time. In 2025, we're at about 3.8% compared with 12.5% nationally. So not only are we seeing a decline over time, we're also seeing that the frequency of substance use in terms of alcohol use in the state of Utah is much lower than the national average as well. So something else I want to call out, even though it didn't drop again from 2023, and this I will reference again in the presentation, holding steady at a really low rate is often seen as a good thing in terms of prevention. So when you see a plateau, it's easy to get discouraged, like we want to get that to 0%. But we are encouraged to see anytime something kind of plateaus over time, just goes to show that prevention efforts are working and we're kind of holding steady. In terms of marijuana, which is our green line here, you can see that it climbed a bit through 2019. That's when vaping THC products were new. Several neighboring states legalized marijuana, but then it starts to bend downward. From 2023 to 2025 alone, we saw a 32% decrease from 4.3%, which again is really low, to 2.9%. So despite easier access, right, if we have THCs available, THC vapes available, and legalization in neighboring states, we do see that use continues declining. So that says a lot about community norms and prevention work that we're seeing at state and local levels. And then finally, we will look at vaping. This is our orange line. We have data dating back to 2011 for vape use, which is when Utah started asking about things like e-cigarettes. You can see a steep climb up to 2019. Again, this is a period kind of like around COVID times when products really hit the market without any regulation. We saw kind of that change in like Juul legislation and then a rise in fruity flavored vapes and other companies. So we do see that spike. In 2023, about 6% of students said that they vaped in the last month. By 2025, it's down about 40%. So we see in 2025, it's down to only 3.6% of students. Again, this is really low. We're also encouraged to see that that's much lower than the national average as well. Yes?
Do you track use of Zyn or the like nicotine pouches?
We do.
Okay.
I'll get into that, yeah. That is a caveat with how energized we are in vape use. We are seeing nicotine pouch use increase, which I will touch on. Okay, so if we were to break alcohol out by grade, something that we see pretty often is that when you're looking at these lines, 6th grade is almost always at the bottom, 12th grade is almost always at the top. We see substance use is the most common for 12th graders, and that is often true at both the state and local level. So as I mentioned, each line represents a grade. 6th grade is here at the bottom, 8th grade, 10th grade, and 12th grade. The vertical axis shows the percent of students reporting use in the last 30 days. So again, we're looking at that more like frequent use of alcohol. And then across this kind of bottom line, we can see use from 2003 to 2005. The most notable change is a tiny bump in 8th grade from 2% to just over 3%. 6th graders remain near 1%, so we'll see kind of, they've never really drank alcohol, but you can see this kind of plateau effect all the way from the beginning of the SHARP survey. Again, this stability at a low rate is something that we consider a big win. Next is marijuana broken out by grade. Just like before, the vertical axis shows 30-day use, and this horizontal is showing change over time. Each line, again, is a grade level. You can see that all of the lines slope downward after 2019. You'll notice like kind of around 2017, 2019, 2020 is when a lot of these peaks are happening for substance use, but then over time we are seeing a decrease. 6th grade, again, stays flat at nearly 0, which is about as low as it can go. We're also encouraged to see a plateau, means that prevention efforts for that group seem to be working. And then finally, vape use. The nicotine pouch use will come when I talk about local level data, just for anyone who's excited. But vape use is the final substance I'll cover at the state level. Again, we have 6th grade, 8th grade, 10th grade, and 12th grade data. You'll see a peak right around 2019 with a steady decrease over time. Vaping has decreased across the board from 2023 to 2025. Also notable, vaping nicotine dropped from 4.9% to 2.9%, and vaping marijuana specifically dropped from 3.7% to 2%. So I kind of alluded to this when I talked about marijuana use, the availability of vaping devices for vaping marijuana. We are seeing that vaping, whether or not it's nicotine or marijuana, has decreased at the state level. I will kind of give a teaser at the state level for nicotine pouch use. I mentioned we have seen an increase in use at the state level. This administration, the number of Utah youth who used a nicotine pouch to try tobacco for the first time, so this is not regular 30-day use, this is lifetime use, increased by actually 312% for all grades. So it was only at about 1.6% in 2023. This did increase to 6.6% in 2025. So this is really encouraging. We're happy to see that vape use is decreasing. I will touch on nicotine pouch use in Summit County though. Okay, the next set of data that I will talk about is school climate and student perceptions of learning. Kind of our key takeaway for the state of Utah is that school and learning are important to Utah youth. So we'll take a look at this first chart. These data are again for the last 3 administrations, 2021, 2023, and 2025. You'll notice that it's by grade, so we have 6th, 8th, 10th, and 12th grade data. We also have what we call our all grade data. This kind of provides like, how are all Utah youth doing? So rather than having it broken out by grade, what are we seeing in terms of just Utah middle and high school student trends? The bars in this graph show the percent of students who said that the schoolwork that they do feels meaningful and important often or almost always. You'll notice that 8th, 10th, and 12th graders all increased positive perceptions for this measure, while 6th graders showed a slight decline. This pattern, older students rebounding more than younger students in the last 2 years, does show up in some other measures as well. So you'll notice that 6th graders may not show as strong of rebound effects as older students, which I'll kind of talk through as I go on. Overall though, this is great news. We're seeing that students are beginning to re-engage and find value in what they're learning after the pandemic. This next chart kind of builds on the last one. So again, the bars show the percentage of students who replied often or almost always to the question of how they, if they feel that what they learn in school will be important for their later life. So again, we have measures for 6th, 8th, 10th, and 12th graders, as well as our all grades measure. You'll see the same effect for 8th through 12th graders, where you see an increase in the number of students who believe that the things they're learning are important for their later life. We also see that more than half of Utah students now say that school feels relevant to their future. So if you look at this kind of like all grades effect, we see that most students believe that school feels relevant and important. This again is a notable shift after kind of the decline of this measure during pandemic times and social isolation. Okay, the next section I will be discussing is mental health and suicide. In general, SHARP data show a positive trend in mental health for Utah youth. So before we look at trends, we're gonna kind of orient again to this chart. So the y-axis shows the percentage of students who said they had seriously considered suicide in the last year. The x-axis shows data all the way back to 2011. So you'll see this similar kind of effect of what we've been looking for data over time to our most current 2025 administration. You can see a clear rise from 2011 through 2021. Unsurprisingly, we see a couple of peaks in 2021 following the pandemic. For all grades combined for this administration, rates fell from 17.6% to 12.6%. We're nearly returning back to our 2013 levels in 2025. This is also the first time that 6th graders have showed a decrease. So I mentioned in some measures, 6th graders are maybe not doing as well in that kind of rebound effect. In 2025, we do see a decrease in sixth graders who have seriously considered suicide in the last year, which is something to celebrate, something we're really excited to see. Eighth grade, notably, is now the highest risk group, followed by 10th, but overall, we are seeing a deeply hopeful trend in that decrease over time.
Question real quick.
Yeah.
What does it mean to seriously consider suicide? How is that defined?
In the survey,
Yeah.
so we do have like spiels at the beginning, but we don't operationalize in the question itself. So yeah, we're not telling them like how it would be different from like person to person to seriously consider suicide. So it is more of a subjective measure.
Okay.
Does that answer your question?
Yeah.
Okay. This next chart shows a related measure, the percent of students who reported making a suicide plan in the last year. You'll notice there are only 3 lines in 2025. This is because this question was removed from our 6th grade survey this administration. Just like before, you can see there's a steady increase for a number of years. We see kind of a plateau from 2021 to 2023, and then we see a notable decline in our 8th through 12th graders. So
Do they tell you why they find this suicide is going down? Do they say the reason why? Is it because of Hope Squad or classes or?
That's a great question.
Because I think we can keep working on what we know.
Yeah.
We know that, you know?
Yeah, absolutely. That is a great question with probably 1 million answers. We do believe that it has to do with prevention, kind of at the local and state level. So a lot of that can be attributed to prevention efforts that are available at the state level. We also collect a lot of data about like willingness to reach out to someone for help.
Yeah.
And we see that has increased in the last administration. I don't believe I have a slide on
Do you
it.
have any idea about the Save UT app? How is it working? Is it working for them?
We don't ask about that on the Sharp, like if they're using the app, but we know that they use Sharp data for their prevention, so I would assume that there's an association between those. But I don't know off the top of my head the frequency of use. That's not something we
come
ask.
into play, the Save UT app?
Just in general, like when was
Yeah.
it founded? That is a good question. I don't
Yeah.
know.
Which one? What is it?
The app, when the app was
Oh, like
created.
a few years ago.
Yeah.
Like 3-4 years ago.
Okay.
Actually, it was funded last year. We went with the American Foundation to. I work for the American Foundation, so that's why I want to know.
Yeah.
I manage the program in Utah. I just wanted. It would be awesome to know more about the Safety app and the 90
Yeah.
days because last year and the year before we are going on the 24th of February to advocate for the laws. This year is going to be fantastic because we are advocating for the laws for pregnant women. Perinatal suicide, which is like really important in Utah because 80% of females in Utah pregnant or after 2 years they had a baby, they might have psychosis, suicidal ideation because of the weather, you know, the dark, and that's 80%, that's what we know. And then I think it's fantastic, it would be awesome if we have a chance to get the data from the state UT.
Yeah.
And if anyone wants to come with the American Foundation on the 24th from 1 to 6 to the Capitol, they're all welcome. We have food, plenty of food, and we were advocating with the legislators. And I went there like 3 years ago. I started going, and we always got the money. Like we got money for the 988. We got money for other. The 988 was created with the Senator Thatcher. He was the one creating the 988, and it was fantastic for the rest of the country. So.
Yeah, that's amazing. We're just kind of like anecdotally, we do hear about all of these programs that are using data to increase prevention. So I don't hesitate to say that probably is having an effect on the trends. We just don't ask students about like specific use of apps like
So
that.
for example, in December, I got a training with the DHHS, and they were saying that suicide increases in Christmas 20% in Utah, which is like we know. So I decided to go to the ERs to bring materials, and it was awesome. Like they told me, thank you for doing it, and I went to the crisis workers and the LCSWs, and they didn't have this information. So we are working with the AFSP. We are really working on getting to know and finding what is it really working.
Yeah.
Like rural areas, doctors are fantastic and the gatekeepers. We train the gatekeepers what else, you know?
Yeah,
But this
absolutely.
is great data. I wish we would have the source of what is making suicide, because it's going down a lot. That's a lot.
Mm-hmm.
Like, for example, I work with Japan and Finland. Finland lower suicide 60%, Japan 50%. Like, so Japan was the number one. And these are the kind of information that we need, like go into detail to know, okay, what are we doing that is
Yeah.
working?
Yeah, absolutely. That is something that I'll discuss at the end of the presentation. Using our crosstab tool is how a lot of folks will use our data. So on our website, you can look at data by question or by age group, by gender. You can like break down statistics and kind of correlate them with one another. So I'll actually get into some examples of that later with like, we see an increase in sleep in this administration, so sleep could have something to do with it. We see decreases in substance use, so if we see a decrease in alcohol use, could that be improving mental health over time? We pause on saying that one thing is causing the other because we don't have that causal data, but we do have really strong correlational data that shows kind of the influence on factors like sleep, technology, things like that, and suicide. So, and I'll get into that in a little bit. Yeah. Did you have a question?
Yes.
What's up?
Why was this question taken off the 6th grade?
Yeah. So that is a question I got on in every presentation. I will be fully transparent that I'm actually new to Utah. I moved here about a year and a half ago. That conversation was had before I even moved here or started this job. So I don't know the like specifics of why this question was taken off. But I do know in our preparation for our 2027 survey planning, we measure a number of factors. So where are we seeing like the most changes in 6th grade data, and that might influence like retaining a question, who's using the question, what do we know about 6th grade development more generally, and what questions might feel more like developmentally appropriate in a research perspective. We also consider like 6th grade cognition, so are they understanding one question versus another? If we know we have a certain number of items we have to eliminate of suicide, ideation, or of mental health, what's going to be the question that they understand the most that still gathers data regarding some type of behavior? So I don't know the specifics of, I'm assuming it had to do with a number of those things, because I can tell you we have an advisory committee made up of professionals from every space in the state of Utah, and it is a very well thought out process because no one ever wants to eliminate a question. So we have like a number of criteria that we have to measure. I just was not part of like this specific conversation.
Oh, sorry for a second.
No, that's
Just because we're seeing like an increasing trend, is there another question that kind of helps to fill in the gaps over the last 2 years? Like,
Yeah, so like we did retain consideration of suicide. We also retain a question about attempts of suicide. So we do have some questions regarding suicide, we just don't have planning. Yeah, which developmentally does, I mean, I would love the data on it, obviously, but thinking about like planning for a 6th grader compared to like action for a 6th grader, I'm assuming that's kind of one of the developmental perspectives they took into account. Yeah.
so there was a lot of pushback in the previous survey about how long the 6th grader survey, but that's why it's shorter. So we had a huge group of people that looked through all the questions, and we analyzed which ones will be less hurtful to use. You know, I'm saying it wrong, but you know, which ones were better to keep, and not having this data for 6th grade and thinking about their age and how much they understand about it. We have but it was because of pushback for the survey to be shorter, and also pushback about the question, because lots of people, like she said at the beginning, think that if you ask someone about suicide, they are going to start thinking about committing suicide. And so it was yes.
So the thing is that with the kids, and I got some data the other day, we had a research with the American Foundation, when we have young kids, you need to be very careful how you talk, because it can be the word effect, the contagious or domino effect. That's why maybe they took it too. That's another. Could be.
Any questions? Okay, so getting into actual suicide attempts. Again, this is gonna be similar to the last three charts we looked at. So on the y-axis, we see frequency of attempts. On our x-axis, we see changes over time. So we see this administration, 8th, 10th, 12th graders all decline to nearly 2011 levels. That is wonderful progress. Again, we see things kind of like increasing over time. We see a little bit of variation. We see our steepest decline in our last administration, so 2023 to 2025. The one line that is moving in the opposite direction is 6th grade. 6th graders' attempt rate line has been climbing slowly since 2015, and in 2025, it actually became higher than 8th through 12th grade frequency of suicide. While these data show incredible improvement for 8th through 12th graders, I'm gonna be using the words from now on, sticky spots. I call sticky spots anywhere where prevention leaders, school administrators, our team is gonna be especially vigilant to data. Anytime we start to see something moving in the wrong direction, or maybe like a more vulnerable group, a trend that we're not excited to see, I'm gonna start referring to those as sticky spots. So this is one of our sticky spots. Obviously not to downgrade the impact of how meaningful this data is, but this is something that we're watching, we're cross-tabbing, we're working with prevention leaders. Yeah.
Are these self-reported attempts, or are these like documented, like medical intervention or?
Self-reported.
Okay.
Is there any question about using this data to change the issue about planning suicide?
What was that?
Is there any possibility that you could use this data to reinstate the question about planning suicide?
Yeah, it's something that I have brought up because I've been asked about it so many times, why we're not including planning. We are seeing obviously like decreases in considerations, but then an increase in attempts. So like, how are we kind of bridging that gap? So that is a conversation that we're having. Again, it's an entire group of people, and feedback that we're getting from like parents and administrators. So I don't have the final say of what's like included or not included, but this is something that we're looking at.
Yeah, because I mean, as a clinician, you have to ask that question about planning, no matter the age. And so I think not to include is important.
Yeah.
Listen.
Any other questions?
Actually, is there other data within the SHARP survey that shows why there might be an increase in this specific group? Or any other questions that might answer this?
Yeah, that's where like the cross-tabbing comes into play. So internally and in conversations with coalitions and prevention experts, like we're always looking for, so if we see an increase in like social media use, for example, or increased access to technology, like that's something that we're thinking about, because we see research that documents the association between like heightened social media use and impacts on mental health and anxiety and depression. We also look at like sleep, which I mentioned already. Sleep is a really big indicator, both in research and just in conversation with prevention folks. So a lot of like cross-tabbing, but we don't have like open responses from students of like, why are you making these decisions? Yeah. Okay. This chart helps us understand who students are talking to when they feel sad, hopeless, or suicidal. So as I mentioned, we want to grasp some protective factors. So if a student is suicidal, if they're planning, if they're making considerations, then who is protecting them? Or who do they feel can protect them, and having those conversations with folks. So we'll focus first on data for I did not talk to anyone. So we ask obviously sources of like, who are you talking to when you feel sad, hopeless? But we also give students the option to say that they did feel that way and did not talk to anyone. We see a really notable decrease from 2023 to 2025. Last administration, almost 43% of students said that they felt that way and didn't talk to anyone. That dropped down to 38.8%. So we are seeing, we're energized to see that students who are feeling this way are not holding it in, they are still reaching out to their community. Another win comes from folks that indicate that they're talking to a parent. We see a really notable increase from 2023 to 2025, from 36.9% to 41.8%. So you can see that difference here in the number of students who said that they talked to parents when they felt sad or hopeless. And then 2 in 5 students who struggle with mental health say they've gone to a parent. Talking to peers remains really common, so that's why this is high. We see it decrease like a little bit, but we are seeing that students are mostly talking to peers, which makes sense from a developmental perspective and what we know about peer associations. We saw increases in the number of students who talk to teachers. We see an increase in the number of students who talk to doctors. We see an increase in the number of students who talk to clergy, who talk to school counselors, or who talk to important non-parent adults, so other adults in their lives.
Do you know if those are female or male students?
This is just for all students at the state level. You guys are asking great questions. Angela? Okay. Social
Because it's a
isolation.
big difference, you know. Like
Yeah, yeah.
80% of people that are suicide are male.
Social isolation is something that Utah started measuring just before the pandemic, luckily. It's obviously become a really valuable indicator, both for our team, for our the health department at the state of Utah, for prevention experts. So this chart combines 4 statements regarding social isolation. It includes, I feel left out, I felt that people barely know me, I felt isolated from others, or I felt that I was around, people were around me but not with me. Looking at the trend lines, you can see that social isolation unsurprisingly sparked after 2019. Again, this is likely kind of an effect of the pandemic, but in 2025 we see that it decreased across every grade. We see the most notable decreases for 10th and 12th graders, or older students, which are almost back to pre-pandemic levels. 6th graders hasn't moved as much, but overall, in general, fewer students are feeling disconnected, and that's another hopeful sign when we're looking at mental health. Sorry, I'm gonna go a little bit quicker so that we can jump into local data. So student health and wellness, SHARP data, as I have kind of alluded to a couple times, illustrate the importance of sleep. We also have new survey questions about screen time to help us understand experiences with screen time and the perceived impacts from the students. So our 2025 SHARP data show a significant increase in the percentage of 10th and 12th graders reporting getting at least 8 hours of sleep per night. So you'll see these percentages just have to do with the frequency of students who report they get at least 8 hours of sleep. The way that the question is framed in the survey, which I'll be able to show in a little, in our local data, it actually shows the frequency of self-reported sleep. So we have like less than 4 hours, and then it kind of increases by hours up to 8 or more hours. This chart shows, again, 10th and 12th graders have an increase in getting 8 or more hours of sleep. This is up to about 30% and 21% respectively. 6th grade dipped just a little bit, but still over half are reporting getting over 8 hours of sleep, which we know developmentally is kind of our gold standard, our benchmark for teens. These look like small changes, or may look like small changes to folks. Something I want to call out is anytime you see an increase, even if it is by 1% or a couple percent, that represents thousands of students in the state of Utah. So I don't want to underscore the value of the effects that we're seeing at the state level. Now we will look at the connection between sleep and grades. So as I mentioned, this is something you can do in the SHARP web tool, so you can build associations between questions. Again, this is going to show a correlation between responses, so maybe pause before coming to any causal conclusions, but as I mentioned, one of the things that we look at is sleep and how that associates with different indicators. So this can include mental health, as we've chatted about a couple of times, and then in this instance, we're looking at self-reported academic grades. On the x-axis, you'll notice this is the number of hours of sleep per night. As I mentioned, we break it down by 4 or less hours, 5 hours, 6 hours, 7 hours, 8, 9, or 10 or more hours. On our y-axis, you will see the percentage of students who report what grades they earn in school. This is broken down by bars, so you'll see this like darker Colored bar is mostly Fs, mostly Ds, Cs, Bs, and then As. You'll notice an upward slope, so the more sleep that students report getting, the higher the likelihood of getting As. This actually peaks at 9 hours, which is a trend that I saw when I was cross-tabbing sleep data. 9 hours is kind of like the golden number for Utah students. Over half of students who sleep 8 to 10 hours report mostly As, while those sleeping 4 hours or less are more likely to report Ds and Fs. Again, we can't say that one is causing the other. It is just an association, but it is interesting to see the impact that sleep might have on grades. Next, we'll look at sleep and substance use. This is the association between sleep and 30-day vape device use. So again, this indicates more regular use of a substance. The bottom axis again shows the average hours of sleep going from 4 or less to 10 or more. On the y-axis, you see the percent of students who self-reported that they had vaped in the last 30 days. The pattern is pretty clear. The less students sleep, the more likely they are to vape. Again, I want to add the caveat, we don't know which is causing the other. So it's possible that students who are, this is actually a conversation that we had last week when I gave a presentation, is like, if students are vaping, maybe they're doing so at night because that's the only time they're able to vape, so they're just going to bed later. Or since vaping is a stimulant, maybe it's keeping them awake longer. Or maybe they're sleeping less, so their judgment is impaired, so they're vaping more. So that's just kind of an example of like, take the data with a grain of salt, but we are learning that there is a very strong association between sleep and substance use. Sleep and mental health. This chart represents the hours of sleep per night and serious considerations of suicide in the last year. At the bottom, again, you'll see number of hours of sleep from 4 or less to 10 or more. On our y-axis, this represents the percent of students who had seriously considered suicide in the last year. And you'll notice, again, the pattern is pretty striking. So among students who sleep 8 or more hours per night, only about 7% reported suicidal thoughts. For those sleeping 4 or less hours a night, it jumps to around 40%. So that is a pretty staggering difference when we look at the number of hours a night students are sleeping. And another reason we should be talking is healthy sleep as a really important indicator for youth health. Okay, I'm gonna hop into screen time. The 2026 SHARP survey included an expanded data on screen time and social media. You'll notice in a couple of these slides, I do not talk about 6th graders. 6th graders do get questions in the category, they just get fewer questions. And the really interesting ones that I get the most questions on often reflect 8th, 10th, and 12th grade data. So this question specifically is we're asking students whether or not they have access to a cell phone or smartphone. We see that in the state of Utah, 97% of 8th, 10th, and 12th graders report that they do have a cell phone. When we ask about how often they check their phone, this includes when they're not asleep or in school, 41% report that they check it around every 15 minutes or less. This is pretty consistent with what we see at the county level. So like right below half of students are checking it dozens of times a day. When we ask about whether or not screen time helps or gets in the way with certain aspects of their lives, 54% of students self-reported that they believe their screens get in the way of sleep. 56.7% self-reported that they believe it gets in the way of schoolwork and homework. And 48% say that they believe it gets in the way of time spent with family. So again, these are all self-reported measures, but it does go to show that students believe that screens are having an impact on their lives and their relationships.
And this is not being given to 6th graders?
These questions were not, no. Now we'll move into screen time. So this is another area that's getting a lot of attention. This was given to 6th graders. On each slide, the bar shows the percentage of students who spend 2 or more hours a day on a screen, not counting schoolwork. That could include texting, social media, or gaming. I got questions on whether or not that is broken out in this administration. So do we ask, like, what are you doing the most when you're on the phone? We have not asked that this administration, but we are talking about including that in our next administration. This was kind of like our pilot screen time data. So just to get ahead of that question. But we do include some sample behaviors. So we have like playing Xbox, PlayStation, texting, YouTube, Instagram, etc. The timeline along the bottom starts back in 2019 when we began asking this question. You can see a sharp increase between 2019 and 2021, so that's these two bars, which makes sense. It's right after COVID. Folks are on their screens arguably a lot more after COVID. I know I started using my screen a lot more after COVID. Again, that's most likely the pandemic effect, but since then we see that things have leveled off. We do see some kind of subtle decreases in 8th through 12th graders, not super staggering, but again, when we see that plateau effect, we're motivated by that. We can also see that understandably screen use is still high. It's unlikely that we'll see a super sharp decline just as a result of the pandemic and increased use of screens. Okay, and then the last component that I'll talk about at the state level is the association between screen time and serious considerations of suicide. Along the bottom, you can see different levels of daily screen time use. So we ask about frequency, less than 1 hour per day, all the way up to 5 or more hours per day. And the left axis shows the percentage of students who seriously considered suicide in the last year. So the pattern is striking. As we can see, as screen time goes up, so do the considerations of suicide. Students who are using their devices 5 or more hours a day are nearly 3 times more likely to report suicidal thoughts than those that are under an hour. Again, this is a correlation, but a great example of trying to understand the association between these types of risk behaviors and then other data that we get from students in the SHARP survey. Okay, I'm gonna briefly go into how to kind of like read your own reports, and then I'll go into what I imagine everyone is really excited for, which is Summit County data. Okay, so the SHARP survey, data distribution, I'm gonna go over to this a little bit more, but our state level profile reports are located on the SHARP website through DHHS. So we do have the reports available at the state level. All of the data that I just covered is available in those reports. New report features include a new parent-facing executive summary. So we've decided to frame this as kind of what parents should know. We also have new data suppression rules just to ensure participant privacy. So anytime we get data that is, our data suppression is less than 11 count, we will suppress those data so that we can ensure the privacy of students and kind of increase anonymity. And then we also have relative standard error measures. This is kind of more of a technical statistical device we use, but essentially lower RSE values indicate more reliable estimates. So it's just something we include for more technical data users who want to ensure that the data we're reporting is actually valuable and usable statistically. Obviously local roadshow presentations, that's what we're doing right now. And then the SHARP web tool is currently being updated with 2025 data. So I don't believe that that's available, but should be available in the next 2 weeks, hopefully. Don't hold me to that. Our profile report sections, this is available both on state reports and county level reports, include, again, the executive summary. We have our introduction, kind of an introduction to how to actually understand the charts and read the data. And then we get into the actual data. So substance use, antisocial behavior, community and school climate, social and mental health, all of the things that I have already discussed. And then something that gets skipped over pretty often, but I have found I've referenced in every presentation I've given, is our appendices. Specifically this risk and protective factor scale definitions. When I show our risk and protective factor data, I am always surprised by the number of folks who know what an operational definition is, but I get questions like, well, how are you defining antisocial behavior? Or how do we know that this student is feeling socially connected? That is where the risk and protective factor scale definitions come into play. So consistent with just research in general, we have a measure that assesses kind of a theme and something that we're seeing that's broken down by a number of items. I will not show those in the data that I'm providing. I won't show all of the items. I'm just going to show the factors themselves. But if anyone is ever interested, I highly recommend looking at these scale definitions to kind of break that down. And then we do have links to the survey forms and our methodology included in the appendix as well. Okay. Some kind of high-level steps for reading and interpreting data. First, always study your participation rates at all levels. So this includes, which you guys have been great at asking, grade level participation, gender level participation. SOGI is a little bit trickier at the district level right now, but SOGI, demographics, kind of like what is making up your sample of data that you're looking at. Asking your district or school how things went. We saw a huge increase in Summit County participation this administration, which is likely due to your survey coordinators, your local level officials, coalition leaders, folks in this room, folks, teachers, parents that are encouraging folks to administer the SHARP and have students opt into the SHARP. So chatting with folks at the local level, we do as much as we can, but ultimately it is up to the district whether or not to participate. So showing that gratitude and kind of engaging with folks. Staying curious when you're looking at the data. So we've gotten great questions today, but staying curious about what the data mean, why things are asked the way they are, what students are reporting, etc. And then again, having faith in robust survey participation, the protocols that I briefly mentioned, our weighting strategies. We go through so many levels of statistical review with so many different partners. So just having faith that this data is accurate and useful and a representation of your students.
For those school districts and or people, parents that you run into, what is the major barrier for like why they either opt out of the survey? And then in school districts where they are opting in, what are the things that parents and or students are saying other than like the 12th graders who are just sleeping all the time or working? Like what are those reasonings that you're getting?
Yeah, that's a great question. The biggest barrier is kind of that misconception that the survey is harmful. Just like very bluntly, parents are worried that if we ask about a behavior, it's going to cause it to happen. So we see in terms of parents, like, why are you asking my student this? How can I ensure that the student is protected? I find that most of the time it has to do with a misconception about either the way the survey is administered, how we're asking things, how we're using the data. Folks who agree to participate and where we see really robust participation, it's just high levels of community engagement. So dispelling rumors about the SHARP, talking about your own success stories of how the SHARP data has been used. The app is a great example. Like, we know that folks are engaging in roadshows. We know that people are bringing resources to hospitals, which is amazing. And really communicating that, like, if we don't ask your students these questions, we just might not have the funding to be able to create these really like robust and important programs. I have never gotten pushback that I think is unfounded. Most of the time it comes from a really sincere place of just concern and worry, which is why I always encourage people to pass my email around, because I welcome those conversations. If you are not a traditionally, like, classically trained researcher, it can become daunting to hear that a student is getting a however long survey, which is why we share the surveys publicly and why we encourage parents to reach out to folks in their community and to reach out to us. So most of it is just like not understanding the survey. Most folks who do have access to the data just approach it with a lot of curiosity. I've never had a district that has regretted administering it. Yeah.
So I can tell you what's happened in Summit County. I've been doing this for 17 years. And so our biggest, so for our small districts, North Summit and South Summit, we had the parent consent in registration for years. And that helped a lot with that. Park City School District, the first time they had it in registration was this last time. And we see an incredible amount of kids taking it this last time. But we saw a decrease in South Summit this year. So I can tell you how many, when you were asking about how many, so in Park City School District, 57% of the kids took it. And in North Summit, I don't have South Summit, they have not shared with us. I know they didn't have good participation. Sorry to interrupt you, person.
No, this is really helpful.
So
Please do.
North Summit this year had 50.5% of kids take the survey, which both schools more than 50% is incredible. But that's one of the biggest problems we had in Summit County. Park City is our biggest school district by far. And so when they didn't have it and they didn't have the participation, that affected. Actually in 2019, was it 19 the year we took? 19 and 21. We have years that we have no data. We have 12 kids take it in 12th grade. We had 12 kids take it, so we had no data. And it's mostly because of that. And we have worked with this district to increase participation, but they were sending out an email to parents, and parents don't answer those. And so it was very difficult when it wasn't in registration to get those parents for consent. One other problem we have in Park City School District more than anything, I don't know, Jed, if you want to say anything, but it's an open campus. And so the parent will say, yes, I want my kid to take this survey, but the kid can decide, I want to take it or not. They can go to Starbucks with their friend for an hour and a half, or 45 minutes, it takes 40 minutes to take the survey. But they will have that time off instead of taking a survey. And so those are things that we have seen up here that have happened. In some
Thank you, that
cases.
was
Yeah.
good clarification, I appreciate that.
Any other questions?
Do you have a technical methodology report that's available, to supplement the report that's online? All I see are just the appendices.
As like a standalone document?
Yeah, or like in addition to it.
Yeah, we do have an educational materials. This is what's available for like public distribution. So we have like flyers, consent letters. I don't know that we have a standalone methodology document, but I can't imagine that's something we couldn't create if you were to reach out.
Yeah, I think I'm just kind of curious about some of the inclusion exclusion, because you said you accept any survey that a student turns in. Did you have a minimum set of responses that students need to answer, or like certain questions? So looking through the report, it looked like about 1,000 people didn't say what grade they were in. So I wasn't sure like what your minimum was to count it, or if you had kind of some quality control to see, like, you said you had honesty questions that were in there. Can you explain that a little bit more?
Yeah, so we have questions like so most of the time we have skip logic, so for like our online survey, if you were to indicate that you've never used alcohol, then we won't ask you about like the frequency of alcohol use or where you're using alcohol. So you'll notice like on a couple slides there are footnotes that say like, this only represents the number of students who have reported using whatever substance. One of the things that we will look at is like, if you report that you're in 6th grade, but you report that you're 17, like that student would be disqualified. So we have a certain level of data cleaning checks like that. Like, one of the ones that we used to do was, which we don't collect this data, but looking at like, that might have been 4 again. Anyway, looking at like any combination of factors that don't match up based on what we know. We also have just kind of random questions that are sprinkled throughout, that I have gone through so many questionnaires recently, I can't even pull one off the top of my head right now. But the honesty questions that ask, I might have it in here. Basically like, we're vigilant, it doesn't go towards like a data we would use for like student health and wellness, for example, but as a way to kind of clue us into what might be a student who is not being honest in the way that they're taking the survey. So we're looking at discrepancies, so we do a discrepancy check is what it's called. We're monitoring honesty questions, and then when I had mentioned like we want to get as much data as possible, and you alluded to this earlier, for a 6th grade survey it was so long that students would never get to the end of the survey. So we include like rotating blocks so that even if students don't get to the end of the survey, we still get some questions from students. But that is just like a developmental concern that you have to consider when you're including a survey this robust, is that you want to include as much data as possible in case like a student decides to opt out mid-survey. Like fatigue is just a real thing, cognitive fatigue for students. So does that answer your question? I would have to.
A little bit.
Okay.
Yeah.
Okay. I can I can like dig that up after, yeah. I'm not confident that we're gonna get through all of the data. So I'm gonna jump into that and have you hold questions if you don't mind. Oh, and I totally forgot to say, so we've created like our 6 steps of data, analyzing your data when you're looking at a report. So the first is just to focus on what's high and low. Lots of folks in here, I am confident, are very good at this based on the questions we've gotten. So like across grades, across substances or behaviors, what are we noticing, what's different, what's high, what's low. Step 2 is observing changes over time. We've already done that a little bit, so looking in the last 2 administrations, looking in the last 3 administrations, looking in the last 20 years. Step 3 is how your data compare to state averages. One of the great things about our county reports and district reports is that we will include state level data indicators. They're these little black circles I'll show you in just a moment, so that you can compare where your county stands in comparison to the state. We also have step 4, how does your data compare to national averages? This is called our Bach-Harrison norm, or our BH norm. This is where students at the national level stand, so they're these little diamonds that I'll show you in just a moment. Step 5 is what patterns are you seeing in general? And then step 6 is putting it all together, assembling kind of your data story. So we have some discussion questions at the end. I'm confident that you guys are well equipped to do this, but understanding like if I'm seeing an association between these 2 data points, what does that mean? How can I interpret it in my region or in the state? I already discussed that. So we're gonna look at local level SHARP data. Starting with participation. So as I mentioned, in most of our data visuals, we have the last 3 administrations, so 2021, 2023, and 2025. This represents our county data, so this is specific to Summit County, and then we also include state level data in our county level reports. This is exactly the same as the participation table that I showed you at the state level, but this is now broken down just for Summit County. So you'll see that since 2021, in Summit County, we only had about 825 survey responses. In 2025, we had 1,442 survey responses. So we're seeing a notable increase from just 4 years ago, which again is likely due to just transparency, engaging with folks at the district level. We have an amazing new survey coordinator on our team who does a great job of reaching out to districts and really catering communication to them. And so we're optimistic that we'll see another increase in 2027 in those numbers. We see, again, a pretty even distribution for male and female, pretty comparable to the state. We see that our SOGI data are suppressed, so we either had everyone opt out or a high enough level of opt-outs that we suppress these data for participant privacy. And then we see similar factors where this is kind of our data suppression that I just mentioned. If we have less than 11 students, those are suppressed as well. Okay, I'm gonna hop into substance use first, starting with those 5 steps. I'm gonna walk through kind of example of how to use the steps of data analysis and interpretation. So these charts are showing priority substance use. Again, we determine Utah state priority substances as alcohol, marijuana, and prescription drug use. You'll notice when you're looking at what's high and low, alcohol lifetime use is higher than 30-day use. This makes sense because this is a metric of experimentation rather than frequency of use. We know that high schoolers most often will experiment with something rather than using it long term. So that's why this is higher. As I mentioned earlier, 12th graders have the highest rates of substance use compared to other grades. This is also what we see at the state level and developmentally. Students also show higher rates of using alcohol than using marijuana. So those are kind of some initial highs and lows that you can see. Number 2 is what's changed over time. We see that rates of lifetime use of alcohol decreased for 8th through 12th graders, but it increased for 6th graders. It's not a very significant increase, but we do see an increase. Rates of 30-day alcohol use also increased for 6th graders. We see that it increased for 10th graders as well. Again, sixth grade use is really low, but it's like a little increase right there. Sixth, 8th, and 10th graders showed notable decreases in lifetime and 30-day marijuana use, and 30-day use of marijuana increased for 10th graders. So again, when we're looking at what's changed over time, we can break this down either at the all grades level or at individual levels. And I'm gonna touch on this one more time in the couple slides. Your data relative to the state. So as I mentioned, each graphic has these little black circles that you can see that represents state level data. You can see that lifetime and 30-day use of priority substances is notably higher in Summit County than it is for the state at all grades. Students who are using, oh,
But it's very similar to the rest of the country.
yes,
We always
yes,
been higher than the rest of the state.
yes, yeah, and that
It's consistent.
that is something actually I talk about on this slide. So your data relative to the nation, you are still using substances at a notably lower rate than the rest of the country. So yes, that is a good caveat to include. Looking at patterns over time, again, we see rates of lifetime and 30-day use of alcohol increased for 6th graders. 30-day use of alcohol and marijuana increased for 10th graders. So this is one of those kind of sticky spots that I mentioned, either at the county level or at the health department, et cetera. That is something that we're looking at, is will we see similar trends in the next administrations where we see positive changes for 8th and 12th graders and less positive changes for 6th and 10th grade youth. Past year alcohol users, so again, this is where what I had just mentioned, this footnote comes into play. We're more likely to use alcohol at home with parents' permission. This is something that I've seen in a lot of different counties in the state of Utah. So we see increases across all grades for students who use alcohol with a parent's permission. We also saw decreases across all grades for students who use alcohol at or near school. This was actually a pretty staggering decrease in 2025. Again, this only includes students who indicate that they're past year alcohol users. Cigarettes and vape use significantly decreased in Summit County. Again, this is what we saw at the state level as well, where vape use is decreasing over time. In general, again, vape rates are still a little bit higher than the state, still substantially lower than the national averages. And then similar to what we see in the state, there's a notable increase in nicotine pouch use at the state level and also in Summit County. So you can see that here we see a spike in all grades, showing an increase in indicated self-reported use of nicotine pouches. Okay, in terms of mental health, Summit County youth report lower depressive symptoms and lower rates of serious depression since 2023. So depressive symptoms, kind of similar to what I mentioned for social isolation, is a scale made up of multiple questions. This part of the chart, we generally only focus on students who scored as having high depressive symptoms. So it's a combined score based on all of those questions included in the measure. We see that rates of high depressive symptoms have decreased since 2023. We also see that fewer students experience serious depression in 2025. So that happened for all grades. You can see decreases in the last administration. We also see in Summit County that this is lower than the state average, and we're lucky enough for 10th and 12th graders to have national data. We see that it is also substantially lower than national rates of serious depression. Students in all grades also see positive changes in suicidal ideation data. So this is one of the questions that we do include for 6th graders. If you ever see data that's missing, well, this is a planning question, so that's why it's missing. But if you ever see data that's missing, I don't think this happens much in Summit County, but like for other counties, it may not have to do with whether or not the question was asked. It may have to do with we didn't have enough responding to show data. So that has to do with the data suppression rule. But we see that in general, we see positive changes in suicidal ideation data. This kind of mirrors what we saw at the state level. That being said, rates of self-harm did increase for 6th graders from 2023 to 2025. Students in 8th, 10th, and 12th grades see lower rates of social isolation Again, this is what we saw at the state level. Post-pandemic, we're seeing a rebound effect. However, I will add the caveat, this is a lot stronger for 8th, 10th, and 12th graders. In Summit County, some social isolation indicators increased for 6th graders. So this included feelings of feeling left out and feeling isolated from others. Those did increase a little bit for 6th graders. Okay, our school climate and safety. Our first question is about the perceived importance of school. So we ask, how often did you feel that the schoolwork you're assigned is meaningful or important? Thinking back over the last year, how often did you enjoy being at school? And how important do you think the things that you're learning in school are going to be for your later life? We see that students in Summit County report higher rates of perceived importance. Again, this is something we saw at the state level. Students who believe the things that they are learning are important or very important increased for all grades in 2025. So when they were asked, are the things you're learning going to be important for your later life, we see that all students are agreeing with that more often in 2025. Yeah.
I just wanted to give you a heads up, there's about
Okay, sounds good. Yeah, we definitely will not get through all the data. I'm happy to share this with anyone that's interested, though. I should have added that at the beginning. We see the top environmental concerns for schools, for students in Summit County are using alcohol or drugs. We also see suicide by student is something that concerns Summit County students. Gun violence or active shooter is third. So that's kind of inching up, we see over time. Summit County students are more likely to feel unsafe in bathrooms and parking lots. So we ask a number of items about perceived school safety for students. We see that most students in Summit County, and this is true for almost every other county, are the most afraid in like restrooms and parking lots. These data notably are going to be the most actionable at the local level. So where we see huge prevention efforts for like suicide, and obviously bullying is one, vaping, alcohol use, these like more specific data, we always encourage people at the local level to pay special attention to these type of data. Summit County bullying rates are again comparable to the state of Utah, so we see less variation here. There was an increase of rates of 6th and 10th graders skipping school because they felt unsafe. We also saw an increase in 12th graders who were being bullied on school property, interestingly. And then we saw a really noticeable increase both at the state level and in every county, a huge decrease in rates of online bullying. However, we added a caveat, it could be due to the placement of the question in the survey, so that is something we're reevaluating, but just a note that I wanted to make. Perceived neighborhood safety increases for 10th and 12th graders in Summit County. It did decrease for 6th and 12th graders. So you can see that here. This is usually the indicator we look at most often since we see the highest frequency, but we do see that neighborhood safety is increasing for older students. Okay, social drivers of health. One question that folks in Utah specifically are really interested in is the perceived risk of drug use. This is one of our risk protective factor items. So we asked students a number of questions to assess perception of risk. So people are moderate at great risk of harming themselves if they use some type of substance. So we ask about alcoholic beverages, smoking, marijuana, prescription drugs, and vape use. We see that the perceived risk of these substances has decreased, I believe both at the state level and in Summit County. This consistent decrease is something that we saw at the state level as well. Students in Summit County report an increase in mobility in 2025. So another one of our social drivers of health, we ask about experiencing any of the following in the last year. We ask questions about people in their home having lost their job, having to change homes, skipping meals, etc. We see that the number of students who have had to change homes in the last year has increased. That being said, the number of students who report that they skipped one or more meals because their family didn't have enough money decreased for students in all grades, which is something we're excited about. We also see this effect of family meals on teen mental health. That's one of the things that we really highlight on our website and in our executive summary. We saw that in Summit County as well. So we see the inherent value of having family meals with your parents. Actually, I'm gonna get through all of the data. This is our last section. So student health and wellness. I'm gonna focus specifically on screen time. So again, I've already kind of referenced this for our state level data, but we're using this data to highlight how students are using their devices. We also ask questions about the rules that parents have for device use for students. So in Summit County, 38% of students check their phone every 15 minutes or less. This is really similar to what we see at the state level, where it sits right around like 40 to 41%. The most common parent rules about screen time have to do with app content. That is also consistent with what I've seen in other counties. Most parents are concerned about what students are consuming when they're looking at their phones, but we see less follow through. So only about 41% of kids say that their parents actually enforce those rules about content. So this is part of kind of what we're focusing on for parent programming, as well as like, if you have these rules, how often are you enforcing them based on what you know about how your students are engaging with these devices? We also highlight how students feel when they use their screens and social media. So again, I touched on this earlier, but over half of Summit County students feel that screen time gets in the way of their sleep and schoolwork. Directly following that is time spent with family. This is kind of unsurprising and actually mirrors the effects that we reviewed when we were kind of cross-tabbing data. Again, another reason that we should trust the data that students are giving us. And then 37% of Summit County students felt that social media made them feel worse about their body. So we do ask, when you're engaging with social media, does it make all of these factors better or worse? We see that Summit County students, 37% felt worse when they were consuming social media. And then the last question is sleep data and screen time. We see that more students, we're looking at health habits and routines in general, sorry. So looking at the frequency of use, how much you're sleeping in a night, and then family meals. So Summit County screen time and sleep data, those crosstabs that I mentioned, are similar in Summit County as they are for the state of Utah. We also see, as I mentioned earlier, more students are eating regular meals with their families in 2025. Risk and protective factors I'm not going to touch on. We're seeing great trends at the state level and in Summit County. So protective factors are bolstering, risk factors are declining. I just want to plug this really quickly. Our website, we've done so much work on our website to create resources for you to share in your community for parents who are concerned about the survey or have questions about the survey. So these are fact sheets for parents. We're hoping to have them for teachers, for counselors, for community members, for whoever. Right now we have 4 just for parents. So how are Utah teens really doing? This provides kind of an overview of some of the things I mentioned at the beginning of the presentation. Helping your child build healthy screen habits, so the data that I just referenced in the last section. How family meals support Utah youth, so what I just touched on in this chart here with the value of family meals. And then helping your child stay vape-free. We also have the educational materials that I just mentioned, so these are any publicly available business cards, postcards, surveys, frequently asked questions, posters that you can download and share with folks in your community. This includes teachers, parents, coalition leaders, public health officials, etc. And then finally, we have our crosstab tool. So I've mentioned this like 100 times, but this is what allows you to look at county or state level data in a way that helps you compare question to question. So a lot of things that you might be interested in, like if I'm seeing a huge increase here for 6th graders, how does that pair with what I know about their sleep habits or their substance use habits? So this is being updated right now. If it hasn't already, I don't believe it's published yet, but this is a great resource that I encourage a lot of folks to access as well. And then I'm just gonna put up my email. If anyone has any questions, this is me. Please reach out. I do respond quickly. If there's ever anything I don't know. Mary Johnston, if any of you are familiar with her, she is now the senior project manager, so she's done all of the, she's been involved with the survey since 2003, so she is the expert. I know you called me the expert, but Mary is the expert on the SHARP survey. reach out to either one of us anytime and we're happy to answer your questions. And with that, I'm gonna put up, if we have time for discussion, we don't. Things to ponder after today, if you ever plan to use the data, and how it might increase your decision-making in your role. But thank you so much for being here. Thank you for the thoughtful questions. I'm sorry I had to speed through the end, but I really appreciate all of you guys and the work that you do in Utah.